Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy. So mainly we are going to talk about the anatomical term of direction inferior or caudal. So this is something that is opposite to the superior or cranial, which we learned in our last session. So this session is in the continuation of the same, where we will be mainly talking about what is inferior, what is caudal, why we use it, what kind of information it provides, and how it is utilized in medical coding examples. At the end of this session, I will also provide you one interview question and will provide you some tricks to remember all these concepts together. Okay. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being, we are just mainly focusing on inferior and caudal, right? But prior to that, you should know about other things that we have already covered, like anterior, posterior, superior, right? So if you know those things, then this one will be very easy for you. And for that, you can also refer the Sharmit digital course book in the description box, which is freely available for all of you. There you will find thousands of sessions available in both Hindi as well as English language. So there is a particular tab for medical coding. Just look for that tab, and there you will find all the resources available in Hindi and English, both languages. So as per your language preference, you can consume the content. In case if you want to ask any questions, you can directly reach out to me through comment section. I would be more than happy to answer all your questions there. Okay. Alright, so let's get started, and we'll start with the definition itself. So here you can see inferior. So inferior means toward the lower part of your body or toward the feet. So it is just an opposite of superior. So superior was towards the head, right? So its opposite, that means toward the feet. So in simple word, you can say that any structure or body part that is closer to the bottom of the body or closer to the feet is called inferior. Okay, so inferior means below, toward the feet, lower part of the body. Now if we talk about the synonym of inferior is caudal. Caudal means meaning is same in both case, like towards the feet, but both, like you can see, both words means exactly the same thing, toward the feet or lower part, but it is used in different context. Now I'll tell you what is the context. Okay, so first term is inferior, meaning is toward the lower part, where it is used mostly in human anatomy and medicine. But if we talk about caudal, it is toward the tail. Okay, because here we are talking about the animal anatomy and embryology. Okay, so in animal anatomy, we are talking about the lower part of the body, that is tail. So toward the tail, toward the feet. So in a simple word, you can say that in human anatomy, the word inferior is more commonly used in general descriptions. The word caudal comes from Latin word called Cauda, which means tail. So caudal literally means toward the tail end. Okay. Now we have few points that will explain you what is the actual meaning. So in four-legged animals like cat, dog, caudal refers to the tail end of the animal. Okay. Now if we talk about the embryology, so caudal is preferred when describing the lower end of the developing embryo. Similarly, if we talk about the neuroscience, caudal is used to describe the structure toward the lower end of the brain or the spinal cord. In case of human anatomy, both terms are fully accepted and used interchangeably. Clear? Now we have some opposite terms. We all know that every term has its opposite. So the opposite of inferior is superior. Okay. That is also known as cranial. So inferior means below toward the feet, superior means above toward the head. So these two always work as a pair. You cannot understand one without knowing the other one. Now let's see some example. The feet are inferior to the knees, the head is superior to the neck. Clear? Now we will talk a bit about the examples and combined directional term with inferior. Okay, so example will give you the proper identity, like how we can refer it. Okay, so you can see the stomach is inferior to the heart. Correct? Because heart comes first, then comes stomach. That means stomach is more towards the feet. So the stomach is below to the heart. The mouth is inferior to the nose. The mouth is below to the nose. The knee is inferior to the hip. The spinal cord is inferior to the brain. The liver is inferior to the diaphragm. So this is how sentences are formed when we are talking about the inferior. And the common meaning of inferior is towards the bottom part of your body or towards the feet. Clear? Now we have some combined directional term with inferior. Let's go see one by one. First is inferolateral, which means toward the lower part of and to the side. Inferiomedial, toward the lower part and toward the midline. Inferoanterior, toward the lower part and toward the front. Inferoposterior, toward the lower part and toward the back. So these are the all combinations that are used with inferior. Clear? Now we will talk about some of the clinical examples, and we'll also look at the those medical terminology where this term is utilized. Okay, so firstly we'll see some clinical example. Like here you can see an inferolateral wall myocardial infarction. That means a heart attack affecting the lower side of the heart, lower side wall of the heart. Then we have inferomedial orbital fracture, which means a fracture in the lower inner part of the eye socket. Then we have inferoanterior chest wall mass. That means a mass on the lower part of the chest wall. And inferior posterior displacement of a fracture means a broken fragment moved downward and backward. So these are the all example where we are using the word inferior, which means towards the lower part or towards the tail in case of animal anatomy, and towards the feet. Okay, now in medical coding, which is Ep-83 times CM and CPT, the word inferior appears very frequently, right? Like inferior vena cava IVC, that means large vein that brings blood from lower body to the heart. Inferior vena cava filter, a device placed in the IVC to prevent the blood clot from traveling to the lungs. Inferior mesenteric artery, which is nothing but an artery that supplies the blood to the lower part of the large intestine. Then we have inferior rectus muscle, which means one of the eye muscle that moves the eye toward downward. Okay, so here again all the word inferior refers to the toward the bottom of your body or towards the feet. Clear? Now if you want to remember this for a very long time, so just give it a trick, this trick. Okay, so here in inferior, eye is there, right? So just remember, eye means it is down low. Eye means it is down low. That means below or toward the feet. So now you can think it like this: whatever is lower down on the body is inferior. So we can say that our feet and toes are the most inferior body parts. Correct? Similarly, if we talk about head, so head is the most inferior body part of our head is the most inferior body part. Clear? You can also relate it with the floors in the building. So the lower floor is the inferior and the higher floor is the superior. Okay, so we can say that inferior means the structure you would see last if you started looking at the body from the top downward. Okay, so if you are looking at the body from top downward in a downward direction, then the last structure you will see is the most inferior part of the body. Clear? Similarly, a superior means head direction and inferior means feet direction. So these are the all things that I had planned for this session. Now there is one question for you. I'm sure you already know about this answer. The question is, what is the opposite term of cranial? I would strongly recommend you to please do share your knowledge in the comment section so that others can take a reference from it, and also it will indicate me that you are learning from this session, and more the comment will be there. Accordingly, I will publish more videos on my channel for medical coding. So please do share your knowledge. In case if you don't know the answer, you can check out the previous session. There I have explained this thing in a very detailed manner. and once it is clear to you, then you can watch this session and share the answer here. But please do share your answer, because it will also encourage me to publish more sessions for medical coding playlist. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.